Terry, the Communications Manager here at the Brant County Health Unit. Here with me, I have Dr. Elizabeth Urbantke, Acting Medical Officer of Health at BCHU. Can we do a quick roll call for all those joining us? I'll just have you state your name and affiliation.
Susan Gamble from the Expositor.
Nicole Lampa, CTV News.
Patty Berardi, Rogers TV.
Okay, thank you. In a moment, I'll turn it over to Dr. Urbantke to make a brief statement. If you're able to, if you could put your phone on mute, we'd very much appreciate that, and we'll save questions to the end. I'll now turn it over to Dr. Urbantke.
Thank you. Thank you for all of you joining us today. Yesterday, the Premier released the framework for reopening the province. This framework outlines the criteria for the Ontario Chief Medical Officer of Health and health experts will use to advise the government on loosening of emergency measures, as well as guiding principles for the safe, gradual reopening of businesses, services, and public spaces. The province is planning a stage-by-stage approach to the reopening of the economy to ensure there are appropriate measures in place so workplaces can open safely. Each stage will be carefully monitored for 2 to 4 weeks as public health units use the data to assess the evolution of the COVID-19 outbreak to determine if it is necessary to change course to maintain public health. While we await specific details of this plan, as has been the case up to this point, Brant County Health Unit and other public health units across the province will follow and enforce ministry guidelines and instructions to ensure Brant residents are kept safe through this gradual reopening. Again, while our residents should be commended on their adherence to the public health recommendations up to this point, this announcement does not mean we can simply jump back into the old way of life just yet. The slight uptick in our cases in Brant we saw last week should help illustrate this. It can be easy to hear talk of the provincial curve beginning to flatten and think we can go back to business as usual, but we need residents to continue to follow the provincial orders and public health guidelines through the progression of our response. Following these guidelines will ensure we don't do too much too fast and see COVID-19 cases begin to steadily rise again.
Thank you, Dr. Urbantke. We'll now open things up for questions.
It's Patty from Rogers. I'm just wondering, we've had new cases confirmed in the last few days, but we're not seeing any increase in terms of the long-term care homes where we know more testing's happening. Are any of these cases related to Ferrero and the 3 workers that were diagnosed positive recently?
There are currently 6 lab-confirmed cases from staff at Ferrero.
It's Samantha Lee from Brant.1. Recently, the province has deemed essential or community gardens as essential, but they will have to meet local medical officer of health guidelines. How do you foresee local community gardens reopening next month?
Yes, so we're working with our community partners, including the City of Brantford on this, and ensuring safe procedures and protocols are in place to reopen this important food source for our community.
Hi, this is Nicole Lampa from CTV News. Looking at your numbers, in comparison to other public health units, it appears as though Brant County is bucking the trend in terms of the number of long-term care homes that are on outbreak. You only have 2 right now, and the number of elderly who have contracted COVID-19 seems to be much lower. Are you guys doing something different over there? Just, basically looking at the numbers, we were sort of scratching our heads this morning in the newsroom.
Yes, we've been really fortunate in this regard. I think our lower overall deaths and cases in the elderly probably relates to the fact that we have had very few cases in long-term care. The fact we have had only a few outbreaks in long-term care with very minimal number of cases involved in each outbreak, I think reflects the hard work our homes have done to protect their residents. In addition, we were proactive in Brant even before new guidelines and directives came out to test and isolate right away with even minimal symptoms. And in addition, Brant County Health Unit staff have worked with long-term care and retirement homes on infection prevention and control and outbreak management prior to COVID, and I think that strong pre-existing relationship has helped.
Do you, with the increased testing, do you expect to have more homes go on outbreaks as those numbers come in, or have you already tested them and they simply don't have COVID-19?
So currently, one of our homes, St. Joe's, is an outbreak because of one staff member testing positive during the mass testing process. So it wouldn't be unexpected to see some cases with this mass testing, and with the strict definition for outbreaks, one resident or one staff member being confirmed positive, we declare an outbreak.
Dr. Urbantke, it's Susan Gamble. Can you confirm that you also mean Telfer Place, though? Is Telfer Place not in outbreak right now?
Yes, but that wasn't, they are an outbreak also, but that wasn't picked up as part of the mass testing. That was picked up just on testing residents for minimal symptoms.
And can you tell us?
Sorry, they've gone on to test their whole facility for staff and residents also. And to date, we haven't received any more positive test results from that facility.
Can you tell us where the testing stands at the various nursing homes? Which ones have been done?
Yeah, so St. Joseph's Life Care is done. Telfer Place is finished. Park Lane is finished. And Briarwood Gardens, Iroquois Lodge on Six Nations. Well, we weren't responsible for their testing. I know from reports at other meetings they were tested. I think approximately a week and a half ago. The plan is to have our long-term care tested by the end of the week.
It's Patty. I just have a question in terms, there's long-term care that is ministry, and then there's long-term care that are private. Are the ones that aren't on long-term care on the provincial list, are they still being tested as well? So maybe like a private senior residence that has a retirement home?
So so retirement homes are a different classification of facilities, and so they are, some of the long-term care do have retirement homes facilities associated with them. Those who do have undertaken to just testing them en bloc. However, you know, with possible future directions, we are looking ahead and possibly in the planning stages for rollout for retirement home testing too.
Are you able to tell us about the Telfer home resident? It's the St. Joe's resident. Are they hospitalized or still in the home, isolated?
So St. Joe's is a staff, and Telfer Place is a resident remaining in place at Telfer Place.
And I wondered about the Ferrero workers. If you could just tell me, there's been an additional 3 workers, you said. Has this affected the other parts of the plant, or have you encouraged them closing or changing their status from last week, where they said they had closed down the one area and sent 3 shifts home?
Yeah, so certainly we are working with Ferrero and doing aggressive case and contact management for those for the positive cases that we've identified, and that would include people from the workplace also. We are in daily contact with them to once again work on infection prevention and control measures and ensuring management of the facility. So they've been very receptive.
If a factory or a public place, a public business, has someone test positive, do they have to announce that?
No.
If we can go back to Doug Ford's plan that's been put on the table, I wonder if you can just tell us two things, I guess, and this is in the field of opinion. How do you feel about the plan? Are you encouraged by it? Do you think it's a good plan? And how are you feeling about how Brantford Brant is doing overall?
So the plan is I think as a high-level plan, it's well structured, that it's a gradual reopening with time in between each step. So the 2 weeks to a month would be 1 to 2 incubation periods for COVID, so that we can ensure that we, once we get past one step, that this hasn't affected the number of COVID cases. So I think this gradual approach is definitely a good approach, and with time to assess and evaluate each step in between. And sorry, what was your second question?
The second question was, how do you feel that we're doing ourselves locally in Brantford Brant?
As I said, I think we were very fortunate that our long-term care facilities have done well. Overall, we've seen a gradual, we've seen a little uptick last week, but in general, we're trending to a leveling off of cases. So the next 2 weeks will be illustrated to see, making sure that we're going in the right direction. I think once again, the majority of Brant residents in the community have stepped up and done the right thing by following public health advice and following the emergency orders. So I think we can be commended, or the public can be commended in that respect.
Can you tell us what's happening with the hospital as far as the number of staff there, and whether how many patients remain in hospital that were infected in hospital? Do we have any remaining patients that were infected through that outbreak?
I don't have the numbers in front of me. To my knowledge, there's no remaining patients that were related to the outbreak, and I don't know the staff numbers off the top of my head. It's best to reach out to the hospital for that information.